Hey, welcome back to Ryan's Nutrition Coaching. As always, you're with Ryan Sanders, your registered dietitian and certified diabetes educator. I wanted to use this video to kind of piggyback on a previous video that I'd released on trying to cure type 2 diabetes. And that is a medication for type 2 diabetes called Metformin, which is a very effective medication for putting diabetes of type 2 nature into remission. Remember, based on my previous video, you cannot cure type 2 diabetes, but what you do have the potential option to do is to put it into remission, meaning that you can balance it completely on lifestyle, healthy eating, managing your weight, getting good quality sleep. But a problem that I run into a lot of times when I'm working with individuals who are pre-diabetic and working very eagerly to prevent diabetes, or those who just got diagnosed with type 2 diabetes, is that they come to me with such a passion to try to reverse or fix whatever's wrong in their body, and they have declined the starting of a medication by even though their doctor had recommended it. And sometimes actually doctors don't start the medication right away. They say, hey, we'll give you 6 months to work on making some changes, and we'll see where we go from there. And I am a big believer in natural things, doing things through good quality food and lifestyle issues, but I do believe metformin is something that once we find out we have a blood sugar problem, I highly recommend getting started on it immediately, right away, and staying on it until you have proven that you have reversed and been able to maintain the 5 lifestyle issues that typically cause type 2 diabetes. So I think it's important in review to understand that when you're at risk of becoming type 2 diabetic or you have type 2 diabetes, you are suffering from what is called insulin resistance, which means that your body doesn't use insulin very well, and insulin is required to lower your blood sugar. And the organ involved in diabetes is called your pancreas. And what we don't want to do is burn your pancreas out sooner. So the progression of diabetes is that the pancreas, upon diagnosis, is typically only working about 50%. It only has about a 50% capacity to make insulin. That depends on how soonly you caught the illness. And as years go on, typically that pancreas continues to burn down until most people with type 2 diabetes need to be on 2 to 3 oral medications, and then most people end up needing a type of insulin to control their blood sugar. Well, metformin has the ability for 2 significant reasons to help prevent or delay that progression. So if you go see your doctor and they tell you that you have a little touch of sugar and that we have to watch it, please make sure you know where you're at in the pendulum of things, or the spectrum rather, of your diabetes, and therefore you can be proactive in speaking about the need to maybe get on metformin, and that will aid you or help you keep your pancreas under control, keep it less stressed, while you work on fixing the 5 lifestyle factors that are causing the problem within your body, or basically things that are causing insulin resistance. So when you go see your doctor, a very important blood test that is often done on an annual or semi-annual basis is referred to as a hemoglobin A1C, an A1C test. And the A1C test is a 3-month average of your blood sugars. And since 2010, they've been able to use that test to be able to categorize people as far as whether they're without a blood sugar problem, are at risk of becoming type 2 diabetic, or they actually have type 2 diabetes. An A1C of 5.6% or less is without any blood sugar problem. You're good to go. A1C of 5.7 to 6.4, that means that you have insulin resistance in your body that has already started and your pancreas is already overworking. And any A1C of 6.5% or higher means that you have type 2 diabetes and you need to work on reversing the insulin resistance. Remember, insulin resistance is where you make insulin but it doesn't work, and what happens is the pancreas senses that the insulin isn't working and tries to work even harder. So ultimately what you need to do is put as much little stress on the pancreas as possible, and metformin is a way to do that. The 5 most significant reasons that people become insulin resistant is excess body fat, being inactive, chronic stress, sleep apnea or sleep deprivation of less than 6 hours per night, as well as smoking. So if you have any blood sugar control issues, you definitely need to reverse those, but you need metformin also until you get those issues fixed for 2 significant reasons. The first reason is because metformin is going to turn down a source of sugar coming from your liver. So when we talk about diabetes, there's 2 ways that sugar enters that individual's bloodstream. Number 1 is the food choices they make, and that's why they need to carb count to put less sugar in their body, and that puts less stress on their pancreas. But they also have an organ in their body called their liver that is not broken. There's nothing wrong with your liver or anybody's liver with diabetes. It is making sugar as it's supposed to. Mine does. Everybody just does. The problem is your pancreas doesn't make the insulin to eat it up like Pac-Man would the pellets. So what you need to do is metformin actually tells that liver, calm down. It turns the liver faucet down a little bit, which puts less stress on the pancreas. Again, that's what we want to do to prevent the progression. There's no real way to control the liver. It's going to do its deal. So you need that metformin to help while you watch your food intake and then also try to reverse those 5 insulin resistance factors. So you need metformin to do that. The other reason, number 2, for why metformin is so helpful is that it actually helps with insulin resistance. It reverses it for you. It starts helping your insulin work better, and that is less stress on your pancreas, because when your body senses that its insulin isn't working, it tries to work harder, and we don't want it to have to work unnecessarily hard. Well, metformin helps with insulin resistance. Now, if you don't start metformin and you spend 6 months without any of it, or you don't start any pills for a whole year, metformin, the pill that I'm speaking about, you are basically making it a lot harder on your pancreas to get the job done. Why waste 3 to 6 months as you try to lose weight before starting the metformin? Metformin actually will help you lose the weight, because the more you can keep your insulin under control, the more you naturally are going to burn fat. But when you don't have that metformin, you have your same old level of insulin resistance, your insulin stays higher, and it's harder for you to burn the fat off your body. So if you're trying to do it on lifestyle factors alone without metformin, it's an uphill battle. Get on that metformin, and the standards of diabetes care, the algorithm of management actually shows that people with prediabetes should be on metformin and coast on the lifestyle factors. And of course, once you have type 2 diabetes, definitely get started on metformin and try to reverse those 5 insulin resistance factors. So if you ever in a conversation, or you know a loved one who just found out they have a little touch of sugar, you need to make sure that you hopefully share this video with them and tell them, you know what, I think you need to get on that metformin until you can prove that you can lose the weight we need to lose, and you can prove that you can get 150 minutes a week, get good quality sleep, quit the smoking, and manage your stress a bit better. Otherwise, you're fighting an uphill battle, and it might be too late. By the time the mission is accomplished, your pancreas may have worn down to only about 25%, and then the need for more medication and even insulin is right around the corner. So if you want to delay the progression, and if you want to put diabetes into remission, you need to for sure use metformin until you can successfully reverse those resistance factors. This is a very important issue that I come across a lot of the times, and please speak up on the behalf of your health. Get on the metformin. I'm normally all natural, naturopathic. I believe in supplementation, but I don't like just throwing medicines at people. But metformin is one of the cases that I do believe it's got more benefit down the road than not starting it. So I hope this helps, and again, keep checking in with me.